Welcome back to another Socrates Medicine video, and we're going to be talking and discussing about why we prone for COVID patients. So the reason that we prone for COVID patients is because the scientific research supports that proning or laying the patient on their belly decreases 28 and 90-day mortality, or another word for that is death. This is the research study that validates prone positioning. It's called the PROCEVA study. It was published in 2013 to the very well-respected and known New England Journal of Medicine. The patient population basically consisted of 466 people with severe acute respiratory distress syndrome, also known as ARDS. And the study writers basically defined severe acute respiratory distress syndrome as a PF ratio less than 150, an FiO2 of at least 0.6, a PEEP of 5, a tidal volume close to 6 milliliters per kilogram of the predicted body weight. So the primary outcome was the proportion of patients who died from any cause within 28 days after inclusion of the study. So the study participants were randomized into a prone positioning group where the patients were placed on their bellies versus a supine group, which acted as the control group, and that means that they laid on their backs. Once those participants who were in the prone group were approved for this study, they underwent a stabilization period of 12 to 24 hours, and then once approved, underwent prone positioning within 1 hour time of approval for a duration of at least 16 hours with a 4-hour break laying in the supine position, and then they would be able at any time to switch back to the prone position. And this lasted for a duration of 28 days. The criteria to discontinue proning included improvement in oxygenation, like a PF ratio greater than 150, PEEP of less than or equal to 10, and FiO2 of less than or equal to 0.6, a decrease in the PF ratio greater than 20% compared to when the patient was in the supine position, or any complications during a prone session such as like ET tube obstruction, hemoptysis, oxygenation less than 85%, a PaO2 less than 55 for more than 5 minutes when the FiO2 was 1, cardiac arrest, or any other life-threatening complication that the physicians deemed appropriate to stop the prone therapy. And then the mortality at the day 28 was lower in the prone group, 16%, compared to the supine group, which is 32%. So that's a lot just to say that COVID is one of many causes of severe ARDS. And so those patients that we see are that qualify for severe ARDS are candidates and should be placed in the prone positioning. And that's all for today. Leave a comment and in the description or anything if you have any questions or concerns. The link up here is the citation for the PROCEVA, and if you wish to read more about the paper, I'm gonna go ahead and link that below as well. So, all right, thank you all for your time.